Obsessive-compulsive and related disorders represent a complex category of mental health conditions characterized by intrusive thoughts, repetitive behaviors, and persistent preoccupations that significantly interfere with daily functioning. These disorders share common features of obsessions and compulsions, yet each presents unique challenges that require specialized understanding and treatment approaches. The classification encompasses several distinct conditions including obsessive-compulsive disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, and excoriation disorder, each manifesting through different behavioral patterns while sharing underlying neurobiological mechanisms. Obsessive-compulsive disorder stands as the most recognized condition within this category, affecting approximately 2 to 3% of the global population across all demographics. Individuals experiencing OCD encounter persistent, unwanted thoughts known as obsessions that create intense anxiety and distress. These intrusive thoughts often center around themes of contamination, harm, symmetry, or forbidden thoughts, compelling individuals to engage in repetitive behaviors or mental rituals called compulsions. The compulsive behaviors serve as temporary relief mechanisms, providing momentary reduction in anxiety levels, yet paradoxically reinforcing the obsessive cycle through negative reinforcement patterns. The neurobiological foundations of obsessive-compulsive and related disorders involve complex interactions between genetic predisposition, environmental factors, and brain structure abnormalities. Research indicates that these conditions frequently involve dysfunction in the corticostriato-thalamocortical circuit, particularly affecting the orbitofrontal cortex, anterior cingulate cortex, and caudate nucleus. These brain regions play crucial roles in executive functioning, decision-making, and impulse control, explaining why individuals with these disorders experience difficulties in cognitive flexibility and behavioral regulation. Neurotransmitter imbalances, particularly involving serotonin, dopamine, and glutamate systems, contribute to the persistence and severity of symptoms across different disorder presentations. Body dysmorphic disorder manifests through excessive preoccupation with perceived flaws in physical appearance that are either minor or completely imaginary to external observers. Individuals with this condition engage in repetitive behaviors such as mirror checking, excessive grooming, skin picking, or seeking reassurance about their appearance. The distress associated with body dysmorphic disorder often leads to significant social impairment, avoidance of public situations, and in severe cases, multiple cosmetic procedures that fail to address the underlying psychological concerns. The disorder frequently co-occurs with depression, anxiety disorders, and eating disorders, creating complex treatment considerations. Hoarding disorder represents another significant condition within this category, characterized by persistent difficulty discarding possessions regardless of their actual value or utility. Individuals with hoarding disorder accumulate excessive amounts of items, leading to cluttered living spaces that become functionally impaired. The hoarding behaviors stem from beliefs about the importance of saving items, distress associated with discarding, and attachment to possessions. This disorder significantly impacts quality of life, relationships, and safety, often requiring comprehensive intervention approaches that address both the behavioral aspects and underlying cognitive patterns. Trichotillomania, commonly known as hair-pulling disorder, involves recurrent pulling of hair from various body regions, resulting in noticeable hair loss. The hair-pulling behaviors typically occur during periods of tension, anxiety, or boredom, providing temporary relief or satisfaction. Many individuals with trichotillomania experience shame and embarrassment about their appearance, leading to social withdrawal and avoidance of situations where hair loss might be noticed. The disorder often begins during adolescence and can persist throughout adulthood without appropriate intervention. Excoriation disorder, or skin-picking disorder, involves repetitive picking at skin resulting in tissue damage and scarring. Similar to trichotillomania, the skin-picking behaviors often occur in response to emotional states such as anxiety, stress, or boredom. Individuals may pick at healthy skin, minor irregularities, or existing lesions, creating a cycle of tissue damage and healing that can lead to permanent scarring and increased infection risk. The disorder causes significant distress and functional impairment, affecting social, occupational, and personal relationships. Treatment approaches for obsessive-compulsive and related disorders typically involve evidence-based interventions combining cognitive behavioral therapy, exposure and response prevention, and pharmacological interventions. Cognitive behavioral therapy helps individuals identify and modify maladaptive thought patterns and behaviors associated with their specific disorder. Exposure and response prevention therapy gradually exposes individuals to anxiety-provoking situations while preventing the usual compulsive responses, allowing for natural anxiety reduction and habituation. Selective serotonin reuptake inhibitors often serve as first-line pharmacological treatments, though response rates and optimal dosing may vary across different disorders within this category. The impact of obsessive-compulsive and related disorders extends far beyond individual symptoms, affecting family dynamics, educational achievement, occupational functioning, and overall quality of life. Family members often become inadvertently involved in maintaining disorder symptoms through accommodation behaviors, such as participating in rituals or avoiding triggers. Educational and occupational settings may present significant challenges as symptoms interfere with concentration, time management, and social interactions. The chronic nature of these conditions requires long-term management strategies and ongoing support systems. Early identification and intervention play crucial roles in improving outcomes for individuals with obsessive-compulsive and related disorders. Healthcare providers, educators, and family members must recognize the signs and symptoms of these conditions to facilitate appropriate referrals and treatment initiation. Public awareness campaigns help reduce stigma and encourage individuals to seek professional help rather than suffering in silence. Research continues to advance our understanding of these complex disorders, leading to improved diagnostic criteria, treatment protocols, and novel therapeutic approaches. The future of treatment for obsessive-compulsive and related disorders holds promise through emerging technologies and innovative therapeutic approaches. Virtual reality exposure therapy, smartphone-based interventions, and neurostimulation techniques offer new possibilities for treatment delivery and effectiveness. Personalized medicine approaches consider individual genetic profiles, neurobiological markers, and symptom presentations to optimize treatment selection and outcomes. Continued research into the underlying mechanisms of these disorders will undoubtedly lead to more targeted and effective interventions. Understanding obsessive-compulsive and related disorders requires recognition of their complexity, diversity, and significant impact on individuals and families. These conditions represent serious mental health challenges that require comprehensive, evidence-based treatment approaches delivered by qualified professionals. With appropriate intervention, support, and understanding, individuals with these disorders can achieve meaningful improvement in symptoms, functioning, and overall quality of life, demonstrating the importance of continued research, education, and clinical innovation in this field.